diversify it, it is hormonal, it is lifestyle thing, it is genetic causes, and of course many males suffering from varicocele. When we come to lifestyle changes, it is more of smoking, alcohol, there is more predisposition towards diabetes, hypertension, and smoking. With that, of course, occupational reasons are also there. Adding to this, there is a lot of EDC today, like endocrine disrupting compounds like heavy metals and pesticides in our day-to-day life today. So yes, these all do contribute to male infertility and compromised sperm count.